Welcome to the Happy Soul Podcast. My name is Melissa, and this is Sammy. We are diving deep into conversations that connect and inspire. Stories of resilience, triumph, and transformation. Stories that take us to the heart of human connection. Please note that opinions of our guests do not necessarily reflect those of this podcast. Please listen with your kindness and an open mind. Each story shared is authentic and vulnerable. Let's embrace our differences with empathy, knowing every voice enriches us. Together, let's cultivate a community of respect and curiosity. Thank you for listening. Now sit back, relax, and prepare to be inspired.
Welcome to the Happy Soul Podcast, everybody. Today we are here with Dominique, who is coming at us from Australia, which is so exciting. It is nighttime for us and middle of the day for her, which always blows my mind. We are here to chat with Dominique about her and her family story and her son, Ashton, who is 7 years old and currently battling cancer. Dominique found us when we did our Childhood Cancer Awareness Day episode with Claire back in February. And we've been chatting back and forth ever since, and we've been really looking forward to chatting with her. So Ashton is in remission. He's been fighting this battle with himself with the support of his family for 18 months. And we just want to ask Dominique to start back kind of at the beginning of the story. Like, where was that? How did that diagnosis go about? What happened that led to that diagnosis and learning about his cancer treatment? Where did that all kind of start for you guys?
Yeah, so back in August of 2022, Ashton became unwell with just a very vague symptom. It was a simple cough. And because it was during the second wave of the pandemic here in Australia, we kept him home from school and we took him to our local doctor, and they felt like they could hear some fluid on his lungs. So they sent him for a simple chest x-ray, and that came back with a large section of his lung whited out, which they assumed to be fluid. So my husband, who took him to the doctor at the time, got advised to put him on antibiotics for just a short course of antibiotics to hopefully clear it up. And Ashton was first diagnosed with atypical pneumonia. And so we were just keeping him home from school, keeping an eye on him. But within my own mind, I felt like he was actually getting a lot better. And I was thinking, oh, wow, he really needs to be back at school with his friends. He's running around the house like crazy, annoying his sister. He was eating and drinking fine. And I remember one afternoon, my mum came over and she mentioned, oh, he looks a bit pale. And I was thinking, oh, no, it's just winter. Kids get a bit pale in winter. He hasn't seen much of the sunshine. But looking back, it's so strange because we were convinced that the doctor's diagnosis was correct and that we were treating the pneumonia and he would be fine and back at school soon. And we had a review when he finished the course of antibiotics that I took him back to the same doctor. Actually, it was his wife, who was also a GP, and she made him take off his shirt so she could listen to his breathing and check out his lungs. And I noticed that when he took off his shirt, his chest was actually, it looked deformed, like one side was sticking out and protruding. And I remember looking and thinking, that doesn't look right, So that was a bit concerning. And then they listened to his lungs and she couldn't get a clear read on if he still had fluid in his lungs or not, even after a full course of antibiotics. So she called in her husband, who was a GP as well, and he had a listen. And he was just like, no, he's not better. You need to go straight to the hospital. And I was like, what do you mean? He's fine. He's still eating, running around, playing. And they were just like, no, it sounds like he hasn't improved at all. Take him straight to an emergency room. And I was like, wow, you guys are massively overreacting here. But I thought, well, I better do what they say. So I met with my husband that afternoon and we took him up. And we kind of made a split-second decision. Do we take him to our local hospital, which isn't a pediatric children's hospital? It's just a small rural hospital where they mainly treat adults. Or do we drive the extra 20 minutes and take him to the specialist children's hospital that we have here in Sydney. And I'm so thankful to this day that we did decide to take him to the children's hospital, because I truly believe that saved his life. So yeah, I'm incredibly glad that we took him there instead of a smaller rural hospital.
Wow.
So what happened when you guys get to the children's hospital?
So we were waiting in emergency for what felt like forever. I think we got there at about 5:30, and we made the decision on the way to drop our younger daughter off with my husband's mother. And I was just waiting with Ashton by myself in the emergency room, and we were waiting for hours and hours. And I remember looking around thinking, I don't even think he needs to be here. You know, there's so many other kids that are sick, they're coughing, they're lethargic and having fevers. And Ashton's just there going, Mum, when can we go home and go to bed? Like, so I remember thinking, do we even really need to be here? But then when we finally saw the doctor at 11:30 at night, they took a blood sample from him, and they ordered another chest x-ray just to see what was going on. But the doctor had to listen to his lungs and said they sound all good. He should be right to go home. And we were thinking, great, we'll just get more antibiotics and go home. But then once the chest x-ray came back, I remember hearing the doctor kind of gasp over, because they had like a doctor's station in the middle. I heard him gasp and go, oh my gosh, look at this, and like call his colleagues over. And then he walked over to us. And I remember thinking, oh my gosh, like what have they found? Like what's going on? And he actually pulled up the x-ray on his phone and showed me, because I had not seen the original x-ray, but the one that they did in emergency that night, his whole entire left lung was just white. Like you couldn't see his lung. And they were like, wow, he's really unwell. Like he needs to stay overnight in short stay. So they admitted us to the hospital at like midnight. And I remember we got into the room and settled in, and like we eventually went to sleep. And then at about 2 o'clock in the morning, I had a doctor wake me up in the middle of the night to say, oh, Ashton's bloods have come back a bit abnormal, but we'll look into it and we'll let you know. And I was just thinking like, okay, fine. Like I was so oblivious to what that could even mean. Like cancer was not on my radar at all. But it was the next morning at about 8:30 when we had our room swarmed by a team of doctors and a social worker. And I was actually pulled by them out of the room and told, we suspect Ashton has leukemia. And I remember thinking like, oh, you guys are wrong. Like he's here for pneumonia and you're just going to drain his lung and we'll get to go home. So I was trying to understand why they were talking about leukemia, which at the time I knew was a form of cancer, but I didn't know that it was blood cancer. And they were just kind of warning me, we think it's leukemia, and then we'll do more tests and come back to you. And at this point, my husband had already gone home, got our daughter, gone to get some stuff, because we had nothing with us at the hospital. We weren't expecting to be admitted or have to stay or anything like that. And I just remember being so shell-shocked that they could even be saying he has leukemia when we thought we were just there for pneumonia. So it was a definite bombshell. And then finally, when they said, your husband needs to come to the hospital right now, like he needs to be here. So I called him and told him he has to come. And I actually ended up telling him over text message that they were suspecting leukemia. I didn't want to tell him over text message, but I think because I knew he was driving back up to Sydney, we live a couple of hours outside of Sydney. I knew I had to tell him so that when he walked in, he didn't just get the news, cold like I did. And then as soon as he got to the hospital, we got pulled aside into another little room and we met with an oncologist. And all I can remember her saying is, Ashton has blood cancer. And after that, I just couldn't absorb any information. Like I just went into shock, and I couldn't believe that they were talking about our child. who had been healthy his whole life up until this point. Like he had never had any form of serious illness, anything other than the occasional cut that needed stitches or anything like that. But yeah, there's something about hearing the words come out of a doctor's mouth and you just can't believe they're talking about your child. So that was, it was just a total bombshell to us. It wasn't on our radar at all.
Is that when it sunk in? Like in that you said like when they first told you it wasn't really sinking in. Is that meeting when your husband arrived and now you're in the room? Was that the sink in moment for you?
Definitely, definitely. Because before they were just like, we suspect, and they kept saying we suspect. But before they even, I should have known that it was true because before they even had that meeting with my husband and myself, they made me tell Ashton that he had cancer in a room full of people with about 4 or 5 doctors there and a social worker there. When I went back upset, they said, you have to tell him, he's going to see that you're upset. You need to tell him that he has cancer. And so I was there by myself. I was 27 weeks pregnant with our third child, and my husband's 2 hours away, and I hadn't even had a chance to tell him or like process anything. And they said, no, you have to tell him because he needs to hear it. It'll be better coming from you. And I remember like looking back now, I really wish I would have stood up for myself and said, can the social worker please do it? Because, you know, I was having trouble processing and even accepting it. And to me, it wasn't confirmed yet, but obviously they knew and they were just trying to be gentle about it or something. But to me, I felt like the social worker could have done that and would have done a better job, whereas I just sobbed and said, Ash, you have cancer, and like we just broke down crying and then everyone left. So it was just this incredibly, you know, isolating experience to have to tell him in front of everyone. And then it felt like, yeah, it felt like we just had a bunch of spectators in the room. And I think even though he had never had much to do with cancer, even at the age of 6 years old, I think he knew that cancer was scary. He knew he was really sick. He knew when the doctor swarmed his room that something was really wrong with him. And he knew, you know, through the messaging, you know, things come up in society that people pass away from cancer. I think he knew all those things even though no one had ever spoken it out loud to him. So just that diagnosis day, I know every parent who's been through cancer, it's something that you're never going to forget. It's ingrained in your brain like it was yesterday. But
I am
yeah,
so
it's so
sorry.
heavy. Yeah, thank you.
I'm sorry. It just interrupted you. I'm really sorry.
That's what I was gonna say too. It's obviously the diagnosis is hard enough, but the situations around that like add to it. You know, I'm not a doctor, I'm not a medical professional, but I feel like there are so many other ways that situation of having to speak to Ashton about it could have gone, and that probably adds such another level to that for you. I'm really sorry that you experienced that. That's incredibly hard.
Thank you. Yeah,
Well,
I just wish, like looking back, as I said, I wish I would have spoken up and said, can the social worker please do it? Because I know, you know, from studying psychology myself, that that's part of their role is to support parents and patients in the hospital. So, you know, hindsight being 2020, I wish I would have spoken up. But in the moment, you're just so shell shocked. You do what anyone tells you to do and you deliver the news and as best as I could. But yeah, of course, we just both cried for hours and I was a mess that day. I don't think I could do anything. And then they were whisking him off for tests and imaging and trying to figure out how they could do, because normally when a child is diagnosed with leukemia, they go through something called a bone marrow biopsy and a lumbar puncture. So the bone marrow biopsy checks if there's cancer in their bone marrow, and the lumbar puncture checks if it's in their cerebral spinal fluid. But because he had this big tumor in his chest, it was actually getting to the point where it was impacting his airway and putting pressure on his heart. So the team weren't sure if he would be safe enough to go under general anesthetic. So they were prepping him for a procedure, not knowing if he would be well enough. And in the end, we didn't get the clearance. But because he was misdiagnosed with pneumonia and we wasted weeks giving him antibiotics, he was actually so unwell that he had cancer cells in his peripheral bloodstream. So they could pick up the cancer just on a normal blood test, which doesn't always happen. And they could figure out that he had a particular type of leukemia. He has T-cell acute lymphoblastic leukemia. And they were able to tell all of that just from his blood test.
Wow. That is, oh my gosh. So what happened? What were the next steps? Like, when did you start getting a treatment plan together and things like that? How did it look from there?
Yeah. So because leukemia is a very quick growing cancer, like it's a quick progressing cancer, they have to start treatment right away. So even though he was really unwell, they actually started him on steroids straight away, which is an oral medication that he has to take, like a tablet. And the steroids, even though they're horrible in terms of side effects, they work very effectively at shrinking and like reducing cancer cells. So they actually use the steroid medication to shrink the tumor in his chest. And like just after he got diagnosed, he actually had to be moved down to the pediatric intensive care unit because the tumor was starting to impact his airway and his oxygen level. And then he actually couldn't start treatment when other kids typically would have started treatment because he was so unwell with his tumor and his oxygen levels. He had to have his first lumbar puncture, which is where it's a bit like an epidural. They kind of get kids spinal fluid out of their spine. Instead of putting in pain medication, they take out spinal fluid, and normally they put in chemotherapy because it's very hard to kill the cancer cells that are floating around in that space without injecting chemotherapy directly into their spine. And he had to have one of those, I think it was day 7 of treatment. Normally they would have done that straight away, but they did that under light sedation, which meant that he wasn't fully asleep. Normally they would put kids fully under so that they don't feel anything, they don't remember anything. But because he was so sick with this mass in his chest, they could only do it under light sedation. And by far, for me personally, the hardest part of the whole journey is, walking your kid into an operating theatre, watching them getting wheeled in on the hospital bed and having to, either watch them get put to sleep or watch them get lightly sedated in that case, and then turning around and leaving them in the hands of complete strangers. And even though our medical team has been absolutely amazing, and thankfully all of the procedures Ashton's have gone completely to plan and we haven't had any unexpected side effects, it's just the hardest thing in the world to hand your child over to a team of strangers knowing that they're about to undergo a very invasive medical procedure.
Mm-hmm. Wow. Yeah.
Yeah.
100%.
Absolutely.
Unreal.
I want to just touch on one quick thing you said, Dominique, and then go into what you were just chatting about. When you were talking about, I wish I had stood up for myself with the doctors. Like, I wish I had said something. And I just want to comfort you in that, because I think that we don't know what we don't know. And we are taught, I feel like Australia's culture is very similar to Canada's in that we're taught like doctors and lawyers know everything, like just trust them, they know what they're doing, like what they say is right, it's all good. And so we're taught like when they tell us to do something that we just need to listen and there's not room for questioning. Whereas like if any other profession told you to do something, you would likely question in some regard because they're not these like praised professions. And it's just a really normal thing that we all have to learn and grow to find our voice and speak up for those kinds of things. So I just want to say, like, I hope you don't hold that on yourself, because you shouldn't. So I just had to say that.
Thank you.
You're welcome.
Yeah, I agree. I completely agree that, you have to learn to question your medical team and your doctors, especially, when your child is going through cancer treatment. You have to kind of get a range of opinions, and you can't just take everything at face value, because this is your child's life on the line. And, as wonderful and amazing as the doctors we have are, they also have to see them as patients. So they have to be a bit removed from it. They don't have the same passion and the same investment in your child as you do. So I've definitely learnt that over the past 18 months. It's our job to speak up for our kids. And, as with any parent, it's our job to speak up if we think that they're in danger, or if something needs to be done differently or looked at by a different person. So
Yeah.
I completely agree.
And even just to ask the questions to fully understand what's going on, because I think often doctors talk to us in doctor jargon, and we're like, I don't know what you're saying, but we never say that. We never say, I don't know what you're saying. We just go, okay, okay, okay. And it's really important to be like, you need to break this down for me. And actually, just because I'm reading Jessica Jansen's book, and she was talking about this, that when her son was diagnosed, doctors were in the room talking in all this doctor jargon, and she was like, you need to stop the doctor jargon right now. I need you to talk to me in normal people terms, because I don't know what you're saying, and I need to know what you're saying. And so, yeah, I think that's really important. Sorry, I just wanted to say that. So what you were just saying about the next steps with Ashton's diagnosis and his treatment, and you had kind of talked about this right before we started recording, so I feel like this ties into what you were talking about. Was you were saying, as you were listening to some of our Mother's Day episodes, you were feeling like you were struggling with the maternal instinct at that period of time. Like, is this the time that you were talking about? Like, how does that tie into what you're talking about in terms of Ashton's diagnosis?
Definitely. So I think I hold a lot of guilt, and it's taken me the better part of the past 18 months to work through that level of guilt, that, because we were expecting another child in November of that year, I was just so focused on, like, how can I work as much as I can, to set us up financially so that I could have more time with the baby when the baby arrives. And we were so focused on, the baby that was coming, and trying to work, and I just feel so guilty that I missed so much of that time between when he first got sick and when he got diagnosed. And obviously, the day that he got diagnosed, I stopped working. I had to kind of leave my job and take leave from that, because I worked as a teacher. I couldn't do anything remotely or anything like that. So I just left my job the day he got diagnosed. And I remember just feeling so guilty, like, how did I miss all the signs and symptoms? But looking at it now, I kind of try to rationalize to myself, even the doctors didn't know what was wrong with Ashton. Even extremely smart people that have been to years and years of medical school did not put the pieces together and go, that's a very weird presentation of pneumonia, and he has bruises all over his legs, and he looks pale. And, if even a doctor couldn't do that, how was I supposed to do that? So I'm trying to be kind to myself, but there's definitely still days even now where I look back and think, how did you miss that? Like, even though blood cancer is so sneaky and it's so subtle and it's so quick moving, that your child can go from well to really sick within the space of a month, which is what happened to Ashton. And I think his doctor, his oncologist, said to us, if he hadn't been diagnosed within the next month, he wouldn't be here. So he was very close to actually passing away if we hadn't uncovered his true diagnosis. So I just have to kind of give myself grace and say, at least you took him to emergency, at least you took him to the children's hospital, at least you got him to the right doctors who could do the correct tests, who could uncover what was actually going on, and we got him diagnosed. And it just breaks my heart for other families out there, who are going through childhood cancer, that I do think a lot of the mums carry the same guilt that I do, that how did I not realize my child had cancer? Because looking back at photos of that time, even I think it was Father's Day weekend, the weekend before we went to hospital. And I took all these photos of Ashton giving his, my husband his gifts, and he looks so unwell. Like, knowing what I know now, he looks so pale, and, you can just tell from looking at the photos. But then I didn't suspect anything. So I have a lot of work to do in forgiving myself for not recognizing what even medical doctors couldn't recognize.
Yeah, you do have, I don't want to be like a therapist over here, but you do have to forgive yourself for that, because it can be a terrible trap for your brain to get caught in, feeling that way and thinking that way. Because what you said is exactly right. If they didn't catch it, how can you hold that on yourself to catch it? Are you seeking therapy to deal with that, to help with that?
Well, that's the thing, is that like we do have a number of free services over here that I've accessed in the past that deal specifically with like childhood cancer families, and I've sought some counseling through them. But in reality, I feel like, there's a lot of limitations to support that is provided through certain charities, and I'm wanting to kind of seek more private counseling once I return to work. But the way Ashton's health has been, like even up till now, it's very hard to go back to working when he's still on daily chemotherapy and having side effects and things like that. So I'm about to return to work, and I'm hoping that once I have some extra income coming in, I'll be able to afford like a real trauma-informed therapist that can help me work through some of this. Because and the same for Ashton, I really would like to get him into some it's hard with kids because they can't necessarily do talk therapy like you or I might do. But if I can find, a very well qualified play therapist who can work with him privately, that's definitely something I want to do, and something I want to do for myself. It just all takes time and resources that we're working on putting together. Yeah.
Yeah, absolutely.
Wow.
Yeah. I mean, yeah.
Oh, go ahead.
I just want to say, like, I just really want to tell you not to hold that on yourself. Like, that's all I really want to tell you is just, I know that's easier said than done, but it's not your fault. You couldn't have done anything differently. I just want you to know that. Sorry, Melissa, you can go ahead.
Well, I mean, it's pretty similar to what you just said, Sammy, but this is sitting on my heart right now to say. So I just, as you were talking, I thought I'm struck by similarities in your story to other stories that we've heard and to other mothers that we've spoken to. And so like Sammy and I cannot sit here and say that we know how you feel. We cannot say that, but I can with 100% certainty tell you that you're not alone in that feeling, and you're not alone in that, in those feelings. 'Cause we have heard that just in our minimal conversations with a small group of people. We have heard that very consistently. So I'm sure that is not helpful, but it's something. I have a question about, and hopefully this isn't too, I don't know, right after talking about that, but when they looked at his x-ray and saw the white, and when you saw the chest that looked different, was that the tumor that they were seeing and they thought it was fluid, but it was actually a tumor?
Yes, you're correct. Yeah. So that was a tumor that it had actually made his chest protrude. And I never noticed it before. And again, I think that's where the mum guilt comes from. Like, how does my son have a tumor? It took up the whole left side of his chest. Because it starts in the thymic gland, which is obviously like right inside your chest, and it's leukemia cells that just grow and grow and grow, and for some reason they just get stuck there and they just grow out of control. And it's something that happens occasionally with children who are diagnosed with T-cell ALL. So yeah, it was just one of those things where I couldn't believe my son had this giant tumor in his chest, and he literally did not have any real signs or symptoms of being unwell other than the vague bruising and the paleness and the occasional cough, that I really felt like it was getting better. But then my husband did point out after the fact, when the doctors were asking us all these questions, like, have you noticed him having any shortness of breath? And my husband said, well, there was a day where he was running around with his sister and then he was kind of struggling to breathe a little bit, but we hadn't noticed any, like he wasn't sleeping more than usual. Sometimes with leukemia, the kids go off their food and like stop eating because they feel so unwell, or they get really lethargic and sleep all day. But for him, he just wasn't presenting like that. And even the doctor in emergency said, oh no, he seems really well, like you guys should be fine to go home. And he was just presenting so well, even though he was actually, like, you know, heading towards death's door very quickly. And it was really hard for me to reconcile, you know, even though they're saying my kid is so sick, he still looks well to me. And I think I just held on to this level of delusion, even when he was going through he did 5 rounds of high dose chemotherapy, and he lost his hair and he lost his ability to walk twice. And he had to relearn all these things because the chemo that they give kids is made for adults. So it has massive impacts on them when they're going through the really intense parts of their treatment. But you know, now I always just looked at him and thought, you know, that's my son and he's well and he's getting through this. So even when he had cancer, I would tell myself, you know, he's here, he's healthy, he's breathing. Like those were my mantras of like, he's here, he's healthy, he's breathing, even though he wasn't, he had cancer. But I think I just had to stay positive within my own mindset. And I would stay so strong in front of him, and I would go in the hospital and have a cry in the hospital shower and just like let all my emotions out away from him, because I didn't want him to see how scared I was that we might lose him. And even though the doctor said when he was diagnosed it's treatable and he's going to have to go through hell to get better, like it's not going to be easy. They gave us no illusion that chemo was going to be easy, and at that time that they didn't know how long his treatment would be. But thankfully, you know, he got through it, and I just had to keep telling myself, you know, he's here and he's breathing and we're going to get through this day. And we got through 100% of our hard days, even though there were many of them.
Oh, Dominique, my heart, like so much space in my heart for you right now, in just how strong you are. And I don't know, sometimes that's helpful for people to hear. Sometimes it's not helpful for people to hear that they're strong. Sometimes it's like, I don't need to be told that I'm strong. I know I'm strong. I need to be given the space to be sad. And you have that too here. But just like the amount of strength it takes to go through what you guys have gone through is a lot. And I'm sure it doesn't always feel like you're being strong. But yeah, I don't know. I don't know.
Like maybe this is a good time to talk about, you were saying about like living life in survival mode. Do you want to talk about that a little bit more, or would you like to keep kind of telling us about like now you're in treatment, you're in the throes of it, and you're pregnant, right? Were you pregnant?
Yeah. Yeah. I was pregnant when Ashton got diagnosed, and we had Haley, I think about almost 3 months into his intense, like they call it frontline treatment. So we added a baby into the mix. But for us, the really difficult part was that we couldn't actually go home. So from the day Ashton was diagnosed, we actually had to be near the hospital. And they offered us a place at Ronald McDonald House in Sydney, but we thankfully had family that lived just 20 minutes from the hospital. So we went to stay with our family. But then suddenly we were this family of 5 with a new baby who was just intruding on our in-laws, on my husband's mum. And yeah, we lived with them for almost 10 months, and we just didn't go home. We pulled our middle child out of daycare, and it's just like our whole life went on pause. And I stopped working. You know, we had the new baby. My husband is Superman and somehow managed to keep his job, which is thankfully remote and very flexible. And he would come work at Ashton's bedside and, you know, keep our family afloat financially. And then it was very difficult throughout treatment because they had visiting restrictions at the time. So children of my daughter's age were not allowed to come visit. But because I had the new baby and I was breastfeeding the baby could come. Ashton was obviously there. My husband was there. I was there. And poor Savannah was just our middle daughter, who was 5 at the time. She just got left out of so many of his hospital stays. And it wasn't until the very end of his frontline treatment that she was actually allowed inside the hospital and allowed to come be with us in the hospital room together as a family. And I just never forget, you know, what a blessing that was to be able to have our whole family together, even though we were in hospital, even though we didn't know when Ashton would be well enough to get out or go home. It was just so special to be together. And once you've been through something, you know, so horrible and traumatic as cancer, especially for your child, you just don't take any little mundane family moments for granted. Like if you have healthy, happy children, just go give them a massive hug this evening, because, you know, there's nothing more important than their health and in being together.
Wow.
Yeah.
Oh,
absolutely. So like, talk about survival mode and all of that, right? Like a typical family, sorry, I shouldn't say typical, a family who doesn't have a child going through cancer treatment welcoming a new baby into the family, whether it's their second, third, fourth, or 15th, is a
lot.
chaotic, quote unquote, survival mode time in someone's life. And so to have that happen when you also have a child going through cancer treatment, like each of those on either end alone are big things, right? To have going on at the same time and be uprooted from your own home. Like,
And COVID.
Yeah, they still had the restrictions in place, and yeah, that's exactly right. But definitely, you know, the hardest times for me was when Ashton was inpatient, because I'm such a type A personality that's a total control freak. Like I have books where I've written down every medication Ashton was given, what time, you know, what nurse we have. So I had a system going of how to manage his care. And my husband, like, bless his heart, he's amazing, but he doesn't write things down. So in my mind, I was like, no, I'm the one that will go with Ashton. You know, I will be at all the appointments and I'll try to manage his care and his medications, and just the sheer amount of medication that these children are on would blow your mind. Like, he has taken more tablets at the age of 7 than I've probably taken in my entire life. And that's all been in the last 18 months. But there was a really challenging time where he had to be admitted to have chemo, and they give the chemo over 24 hours. And because it's so incredibly toxic, you would have to stay inpatient, and then they have to flush it out of his body with lots of fluid over the course of like 2 or 3 days. So you knew you had these admissions coming up where you have to be in for almost a week. And they were kind of what they call planned admissions in his treatment. And he had to have 4 of those. And of course, Haley was all of like, 2.5 months old at the time. And I was saying to my husband, like, do you want to do the admissions, or should I stay with Haley, or do I go with Ashton? And he kind of was just like, you decide. Like, I know it's really hard for you because I was so attached to Ashton being my firstborn, who's so unwell, and knowing how hard the chemo is going to be on him. So I had to pick, do I stay with the baby at home, or do I go with Ashton inpatient? And I let my husband handle the first one. And unfortunately, Ashton had a whole bunch of complications and ended up being in for 2 weeks. And I would go visit during the day. And then eventually we just had to swap because he got really unwell. And then I could have had Haley there with me overnight as well. Like, they would have allowed that because I was breastfeeding. But at the same time, I just felt, well, everything that if Ashton vomits or has any kind of bodily fluid accident, it's all cytotoxic. Like it's really, really dangerous for, an adult who can put on like gloves and PPE, and the nurses come in full protective wear and everything. So I was like, that doesn't seem like any place to keep a baby overnight. So I said to my husband, we're not going to let Haley stay overnight. So I just had to be away from her. And it did cost us our breastfeeding journey. It cost us that. But at the same time, I feel like I made the right decision to be there for Ashton, because he remembers that time so vividly. And whereas Haley was only 3 months old. So I'm hoping she doesn't remember, and we've been able to build like a beautiful relationship, even outside of getting those early months together. So I guess I'm just thankful that I had the opportunity to be there for Ashton when he really needed me.
Yeah,
But it was
absolutely.
definitely hands-on, all survival mode. You couldn't plan a day ahead. You can't plan your life. You never know when you're going to end up in emergency and having to stay in hospital for 2 weeks at a time. So there was no point trying to plan anything.
Wow.
Can you speak on like what that was like mentally in survival mode? Like obviously that's the physical results of survival mode, is you can't plan. It's all kind of on call. You never know what's going to happen. What was the mental load like for you living in survival mode there?
Yeah. So for me, the mental load was like extremely high anxiety. I think I definitely got depressed because I didn't know how this was going to turn out for my son. And obviously he was my number one priority, like ensuring that he somehow survives this. Not that you have any control in the situation whatsoever. But for me, it looked like some nights I would be, I hold it together for my kids all day. And then when they're asleep, I would just cry myself to sleep, or I would stay up till 2 o'clock in the morning researching like what treatment options are there for his cancer, because you just never know if it's going to come back, anything like that. And the fight is so much harder if they have to fight again, because all the chemotherapy that they have already is less effective. So I was looking at, what countries overseas do treatment, because even though Australia is very medically advanced, like we don't have all the answers. So yeah, I would spend my nights up researching, and then I would probably get like 3 hours of sleep, and I was just burning myself out. But then at the same time, you have this very interesting phenomenon that happens where you switch off emotionally too, because I would have thought, if my kid's going through cancer, I would just be a puddle on the floor crying every day. And that's not how most people respond at all. They actually kind of detach a bit emotionally from it, and they focus on like doing what needs to be done to get through the day and to get through treatment, and just focusing on that next step in their child's treatment program, and making sure as much as they can that their child gets through it with the least amount of side effects.
Wow.
Yeah.
Holy. Do you want to tell us a little bit more about the treatment? I mean, you said something about having gloves on and it being toxic and flushing it out. My mind is already blown.
Yeah.
That's wild. And did I hear you say, and I think I've heard this before, but did I hear you say that the treatment that they give to kids is meant for adults? Ooh.
Yeah. So actually, pretty much all of the treatment that my son has had, it's all extremely outdated. He's been on all these different chemos, and every one of them was horrible. Like I can't even begin to explain, what is wrong with the drugs that these children are put on. But like the side effects, they give you these fact sheets every time that they start a new round of chemotherapy with drugs that the child hasn't had before. And obviously, like any medical fact sheet, it will list out, the common side effects, something like, they might get mouth sores and sores throughout their intestinal tract, which is so incredibly painful that the child can't eat or drink for days and days. That was a common side effect. But to give you an example, so many of them had as a rare side effect, they can cause death. So
What?
they can cause the child to die because they are so toxic that they can't even guarantee that the medication that your child is getting isn't going to somehow take their life. A lot of them cause kidney damage, liver damage. My son, he actually developed a severe toxicity to a chemotherapy called vincristine. And it's such a harmless looking one compared to some of the other ones that run through. It's a clear fluid that they give in the IV and it goes over 5 minutes and it's done. But that actually caused his kidneys to start kind of shutting down. And he developed a condition called SIADH, which is where your kidneys aren't working effectively to get the fluid out of you. So the fluid just starts going everywhere and building up within your body. And he became really unwell during that time. And it was only that he was about to stop that chemotherapy, thankfully. He'd had all of his doses, and thankfully they don't use it in the next phase of treatment here, that he was able to recover and his body recovered on its own. But he was so unwell, like the amount of nights where he had to have something called a rapid response called, which is when your child is becoming sicker and sicker in hospital. A nurse will press a button and all these doctors run up and they just run into the room and assess your kid and try to figure out, do they need to go to the ICU or not? And we've had that happen at least 10 times because of the chemotherapy. It's not anything that Ashton went in or he had this problem before. He had no health issues before. And the chemotherapy just makes them so unwell that their kidneys stop working and like it just causes all these issues. He ended up on a drug called gabapentin, which is to stop nerve pain. And I realized at the time, like he ended up on another drug that my 90-year-old grandfather was on. And here he is at 6 years old on the same drug as my 90-year-old grandfather to manage like fluid retention or nerve pain that he was having. And it's just like, you just look at it and think, how is this the best that we can offer our kids right now? So I've been working very closely with an institute here called the Children's Cancer Institute because they fund research here specifically into childhood cancer. And I'm such a big advocate for funding childhood cancer research. And I'm so grateful to both of you ladies for pushing that on your podcast and encouraging people to donate to cancer research in Canada, specifically for kids, because the research is what's going to get them kind of treatment and get them to a point where they don't need to live their life in a hospital for 10 months at a time, that they can go be kids and they can be at home with their families instead of isolated in a hospital room.
Yeah.
Oh.
I think,
my gosh.
I mean, I know talking to a couple other oncology families talking about the treatments their kids have given, and obviously they're all very different in terms of like the order they go in and how they're given and things like that, but the side effects of the toxicity, and I know that intestinal one was one that we'd heard before, it's like, it's just wild. And to think that's what's going through. And I think the hardest part, and I mean not the hardest part, there's a lot of really hard parts, but one of the craziest parts is if you go to an adult and you say you have cancer, you need to go on cancer treatment, here's your medication, here are possible side effects. The adult taking this medication has like a right mind to be like, okay, I'm prepared. Like, this is what I'm calling on to myself to get rid of this cancer. A child has no ability to recognize what they're about to go through. They just have to trust their parents who are trusting the doctors that what they have to go through is the right thing to do. And like, that sits so heavy on my heart of like that whole situation of being a parent, watching your child have to go through this treatment, knowing that you have to do this to make them better. Like, it's just, and you hear stories of like another oncology family that we follow. She just posted about, I think he was in Australia actually, a gentleman who treated himself that he was a cancer. he had cancer, he treated himself, and the like medication he gave himself, like at this point in time, has cleared up his cancer and was not nearly as horrible as all of these side effects are from these cancer treatments. But like, it's not tested enough. Like, he just used himself because he could. And so it's like there's these things out there that obviously exist. They just haven't been trialed enough to be given to other people. And it's just like heartbreaking. Like, why? Why haven't they been? You know?
That's awful.
Definitely. And I think the interesting thing is here too, because, you know, you look to bigger countries like America and they've got a lot of trials going on, you know, even for pediatric patients. And it's like, how do families in Canada or families in Australia get access to those same treatments? It's very hard when countries are at different stages in their like drug approval process. And I'm sure Canada is probably as stringent as Australia. They're actually very strict about, you know, what drugs get approved for human use and pediatric use and things like that. And so at the moment, like to give you an idea, but Ashton's on 2 oral medications and they are what is currently keeping his cancer away. He has tablets every day, and 1 day a week he has to take 2 forms of tablets. And one of the drugs was first developed in 1951 and the other one was developed in 1947. And that is what he's taking away to keep his cancer away. And it's just like, how have we not come up with anything better yet? But I think we are so close to amazing things happening. Like there are certain immunotherapies starting to come out for kids for certain types of cancer. And it's just, that's what we want to see for all kids with cancer is things that use the child's immune system to fight the cancer rather than toxic drugs to fight the cancer. And the way the oncologist typically explains it is kids actually get more side effects from chemo than adults, because in the sense of when you're a child, so the way chemo works is it attacks fast growing cells because cancer cells are typically fast growing. So the chemotherapy goes for fast growing cells. When you're a child, every part of you is growing and changing and developing. So when you think about putting something toxic that targets fast growing cells inside the body of a little child, you're actually going to see, you know, a bit more widespread side effects within them, because every cell in their body is growing and changing in some way. So to think of it like that, it just makes you realize, wow, we need to do, you know, so much more for our kids. And so much oncology research is funded by parents running fundraisers, you know, people who have been directly impacted by cancer. But it's always lovely to see the impact of people who haven't been directly impacted by cancer still donating, still helping raise awareness, you know, walking alongside families like mine to make a difference, because they can put themselves in our shoes, even if only for a moment, to imagine, well, what if that was my child? Would I want them to have to go through these horrific side effects and risk losing their life to treatment? Like, of course not. So I think once you realize the reality of what our children face, you kind of can't not help but support the research and looking for something better than what we currently have.
Yeah, I want to commend you, Dominique, because like what you're doing and what other oncology families are doing to raise awareness while you're going through it is like unreal. Like it's next level amazing. And like, as much as it sucks, like it is, you would rather not be doing this, and I know that you would rather not be doing this. You would rather know nothing about childhood cancer. I fully know that. So the fact that you're still doing it even through all of this is really amazing. I just want you to know that. And yeah, I
agree with that. I agree with that. I also want to say you blew my mind. I'm so glad that you explained the treatment like that. That is massive. That's going to be one of my big takeaways from today. Like that 1947? Did you say 1947?
Like,
Yeah.
y'all, that's when they used to smoke on airplanes. That's how outdated that is. Like, can we think about all of the other parts of society that have changed?
I was gonna say we
since-
have these cell phones, but we don't
Yes.
have better treatment for cancer. Like,
What the shit? Like, the amount of things, like, can we, you know what? That's going to be one of our social media posts. I'm writing this down.
What the shit? That's gonna be
What the shit? Yeah, it'll be called What the Shit. But listen, like, I'm going to go into 1947 and I'm going to pull out what life looked like in 1947 and why the shit are we still treating our children specifically with something from then? I'm writing this down. I'm like, pow. And like the way that you explained, the minute you said the fast growing cell things, my whole body was like, oh, that's why. That's wild. Okay, so you're saying that he's taking tablets and he's in remission. So I'm really naive here, and so I would like to know, because I've heard this before in remission, but in chemo, can you explain to those of us that are like, in my naive brain thought remission equals remission, it's gone, we're not in treatment anymore. So can you explain that? Can you kind of touch on that a little bit?
Yeah, definitely. So, basically, especially with leukemia, I know it's different for different types of cancers, but leukemia actually, because it's a blood cancer, you think about your blood circulating throughout your whole body, how easy it would be if you just had one cancer cell left for it to regenerate and just take back over. So because blood cancer in particular is really sneaky, it likes to hide in places in the body, including, like I was saying earlier, the spinal fluid. It can infiltrate, different organs of the body, like the thymus gland, and for boys, the testicles as well. They can actually relapse and get cancer in their testicles, and it won't be testicular cancer, it will be leukemia cells. So they used to have a 3-year treatment protocol for boys, and boys would have to do treatment for 3 years. And that would look like, you do your 5 or 6 intensive blocks of chemo where you're doing the high dose chemo and you're in hospital often, and you're doing, you're really, really unwell. You've lost your hair, your mobility's coming and going, and that's the really intense, hard part of treatment. But for blood cancer, because it's so good at hiding at places within the body, they really want to wipe it out entirely, get you into remission early, ideally. So for a certain type of blood cancer, the child needs to be in remission after the first month of treatment, even though their treatment will go for 2+ years. They want to see them in remission early. And for Ashton's particular type of cancer, there's a bit more, like, because it's harder to treat, it's deemed a bit more difficult to treat, because it is in the T cell area, that basically they want them in remission by the second block of chemo, which is called consolidation. So by, I think it was day 79 for Ashton, so about 3 months into treatment, he was in remission, and that was considered a good thing still. So that he went on to have the rest of his high dose chemo. And then after you finish the most intensive part of treatment with the goal of wiping out all the cancer cells, they still keep the leukemia patients on a dose of oral chemo for the next year or year and a half, depending on how long the frontline period went for, to just keep the cancer away. They don't want, the way it got explained to me is that it's very immature, like blasts. The cancer cells come out when their immune system gets above a certain point. So they want to keep them immune suppressed for the whole duration of the 2 years, so that the cancer can't come back. And then when they're off treatment, their immune system starts to kind of regenerate and get back up to higher levels. And sadly, that's when you do see a lot of kids relapse, like off treatment, and the cancer comes back because they're no longer immune suppressed. So right now, Ashton is going to school and he's, going to doctor's appointments and seeing friends, all while still being immunocompromised, which is another thing I was going to touch on too, is that even though his hair's grown back and he looks really well within himself, like we are by no means like done fighting cancer. And I think the idea that you're ever done is such a fallacy as well, because there's so many long-term side effects of all the chemotherapies that he's had. I think there's a statistic, I'm sure you might have heard already, but 70% of children who go through cancer have some like long-term side effects throughout their life. So, the odds are is that even if your child survives the treatment, survives their cancer diagnosis, they're going to have something pop up down the line that will impact their health. So one of the chemotherapies he's had can impact their heart health. And it's just terrifying to think that, some of the drugs that he's already had that we can't change now could go on to impact him in the future, even if his cancer never comes back. Yeah.
Yeah.
Wow.
That's the
gosh.
wildest thing I know, like that one of the wildest things. I keep saying that's the wildest thing. No, they all are wild things. None of them are top, but a wild thing is like, here, we're going to get rid of the cancer, but we're going to give you heart disease. Like I keep hitting my microphone. We're going to get rid of the cancer here, but we're going to give you testicular cancer instead or whatever, right? Like it's just like it's so wild that's some of the side effects. I want to ask, sorry, Melissa, I know you have a question, but
Go ahead.
with his treatment, has there, I know this is kind of like it's a health side effect, but because he's a boy, is there a difference between like a boy's fertility and chemo treatment versus a girl's? Do you know the answer to that by chance?
Yes, it's interesting because I know, a lot of parents are extremely worried about their child's fertility, especially knowing all the toxic, treatments that they get as young children or as teenagers. And I think the fertility preservation options really depend on a lot of different things, like how old the child is when they get cancer. I know, like from asking doctors about Ashton, that they can't really do anything for prepubescent boys. So boys who haven't yet gone through puberty, they can't do anything because they're not producing, anything to be able to make a baby with yet. Teenage boys, they can definitely do fertility preservation, and they would recommend that if they were going through like a bone marrow transplant or anything, certain types of chemo, but not every boy I think needs to do that. And similar for girls, obviously girls it's a lot harder because they're born with their entire like ovarian reserve. That's just what they've got throughout their whole life, and whether they're ovulating or not, they can still do fertility preservation, but it's a lot more invasive. And I don't think they would do that for leukemia kids unless they were heading to transplant, is my understanding, because the chemotherapy and the radiation especially can impact it, from what I understand. But obviously not having a girl myself going through treatment. I just know that it's more invasive for girls because I've followed other children's stories that have had female fertility preservation, and it's a whole surgery of like removing an entire ovary and preserving the ovary.
Wow.
So it's very serious, and they only do it, I think, when they feel like they absolutely have to. But I think a lot of parents face the reality that because when your child is first diagnosed, they're so unwell and the main focus is saving their life, you don't get really given all the information, all the options, the ability to make those decisions on behalf of your kid, because almost their care team might have made an executive decision. It's more important to save the child than to preserve their fertility. So yeah,
Totally.
it wasn't even brought up until Ashton was like halfway through treatment for us, and we had to ask the question again. It was on us to go, how will this impact his fertility? and ask those questions. And the way they explained it to us is, you know, it shouldn't impact his because he's going through it before puberty, and hopefully he will go on to have a normal, you know, development in that area.
Okay.
Wow.
Yeah, that's what I was curious about, is because with girls, they're born with it. So if they have any treatment, like, it is what it is. Whereas boys, it's an ongoing creation of it, right? They're doing it all the time. So I was wondering if that was the thing, but it sounds like they don't know. It'll have to wait and see for him as to what that will be. Yeah, I know.
Yeah.
And that's the thing too, right? Is like, in the grand scheme of things, fertility is minor compared to surviving. But I know that it could be a big one, because it's like you've made this choice. And even, you know, when people are treated for cancer, like exactly like you said, you don't really think about it. It's not your first thought. It's not till later that you're like, oh, wait a minute, like, this will impact that too. Yeah.
I don't know how you would have the capacity to soak in. I mean, I just cannot imagine. You've got so much information flying at you. You're so worried. Now you're worried about his immune system is compromised. There's all of these things. And now you're working, like what Sammy was saying about, like, now you guys have somehow are finding the capacity to be advocates and be, like, you're raising funds and you're working in that department as well. I mean, that just completely, the capacity just blows my mind. Like,
Yeah.
It makes me feel like a real wimp when I'm like, I don't have the capacity for this today. And then I think about this and I'm like, oh, step up, girlfriend. Because, like, gosh, you guys have just the capacity for you to deal and take on is just amazing.
I want to just add on to that before you ask a
Go
question
ahead.
really quick, Melissa.
Yeah.
Saying that your capacity is unreal, I don't know how that is received. I think everybody can receive that differently, because I feel like when you're in your position, it's like, I don't want to have this capacity. I would rather not have this capacity. And it's a necessary capacity. It's not a chosen capacity. And I think that's the hardest part, is it's like, people are like, oh, you're so strong and you have this incredible capacity. And we mean that as a compliment into, like, how well you're handling this. But I want for us to let you know that we also recognize that it's not always a compliment, because it's like, it's not I'm choosing to have this capacity. It's, I have to have this capacity to survive. And so I just want you to know that I know that we've said that a couple times, but we also, we can't understand everything that you're going through, but we do see that piece of it, that it's not a good thing in some cases, that it's like, I didn't choose this, and I don't necessarily want it. I have to carry it. So I just want to acknowledge that.
No, that's so true. And I think I know for me personally, I draw a lot of strength from talking to other oncology parents and oncology mums in particular, because they are a wealth of information. And sadly, in this world, there's always people that are ahead of you in their cancer journey with their child. And there's, you come in at a certain time, and then sadly, there's people behind you that are going through it, going through, being newly diagnosed and things like that. And I just draw so much knowledge from the mums around me, because they take it on, and they might have experienced this, and they're just a wealth of information. And sometimes we joke that, like, they know more than the doctors do, because the doctors come at it from a very clinical perspective, but talking to other parents, you just realize, like, everyone cares about each other's child and their child's well-being and their child's survival. Like, it's this big family, and it's just the most beautiful thing, like the friendships you make with people along the way. And when Ashton was first diagnosed, one of the things I did was I went on social media and I found online support groups for leukemia, or I found people sharing their child's story on Instagram and things like that. But that's what motivated me to start a page for Ashton's journey, not just for Ashton to look back on when he's older, but also to kind of support other families that are looking for a bit of hope. like maybe their child was diagnosed with the same form of cancer, and you can't find a story out there where the child's doing well. And, you know, you just kind of think, well, you know, there's got to be other people out there, and the connecting with them is so important. So part of why I share is for my own connection with others and to help other people looking for some hope, because it can be really bleak, you know, when you go online and you hear of another child who's passed away. And I can guarantee any day of the week I can go online and hear of another child passing away from a form of cancer. And it just blows my mind that it's not in the news every day and that people don't read about it every day. And it's like we're in this little corner of the internet going, advocating as loud as we can for the kids and better treatments. And it's kind of like, are we just talking to each other sometimes? But I love hearing from people who aren't involved, you know, who want to learn more, and like yourselves, who are willing to share the message with us and help it get out to a wider audience other than other cancer families. It's so important. So thank you.
Oh, of course. Of course.
Wow.
Like, this is huge on our hearts now.
Okay, I wanted to ask, how is Ashton now, and how has he been with handling all of this, handling the treatment, handling the mental side of it? Like, how is he doing? We've talked about how he's doing physically. How is he doing mentally, and what was this like for him to go through this journey and to be where he's at now?
Yeah, that's such an important question. Thank you for asking it, because I think it's hard, you know, to look at a child who's looking healthy now, and he is a happy kid overall, but he's gone through a level of medical trauma that most adults can't even fathom. Um, just things like when he was first diagnosed, he had to have a cannula um, put in to take bloods, and they were taking bloods like at first every couple of hours, and then eventually it moved to every 4 hours to check what his cancer was doing. And that went on for, I think, 3 days, and the cannulas kept failing. So they would have to take them out and replace them and move them. At one point, he had a cannula in his hand, in his elbow, on his foot, and he had to have the boards that keep your arms straight so that he didn't accidentally knock it or rip it out. And just the sheer level of trauma that he went through in the first couple of days, constantly being taken off for scans and just, you know, I don't know, the sheer level of grief that we all felt at finding out how unwell he was. It was all very traumatic for him. And I think going through treatment, he handled it as best he could, taking it in his stride and trying to manage each thing. But obviously, coming back to the place where you've been traumatized over and over again, to get more trauma added on top of it in the form of treatment and being put asleep for procedures. He's actually had 21 procedures in total. 20 of them were under general anesthetic, and they all happened in the last 18 months. And it's only of January of this year that he's officially finished having procedures. And the only way that he would have another procedure done is if he either has a side effect of treatment that requires surgery, or if they suspect that he's relapsed and the cancer's come back, they have to put him asleep and do another bone marrow biopsy and another lumbar puncture. So he had a lot of anxiety around the hospital and being in hospital and having things done to him against his will, because in the early days, it's so critical to get treatment done. You have to force them to take their medication. We had nurses coming in and literally forcing a syringe of medication down his throat. And we were just so shell-shocked as parents that we didn't know to advocate that we could do it on our own time and that it didn't have to always be done on the nurse's schedule. So he had a lot of things done to him against his will, in terms of blood tests and medications. And then at our hospital, I know a lot of hospitals in Canada and America seem to use ports, which are like under the skin, so that they can access the child for chemotherapy and give chemotherapy in a safe way. But at our hospital, they insert something called a central venous line, which is a medical device that actually hangs out of the child's chest, and it has like little lumens or noodles, the kids call them, that they can attach IVs to. And so I think it was around his 7th day of treatment where he was well enough to go under surgery and have that placed. And he woke up with a scar on his neck and a medical device hanging out of his chest. So the fact that he had to learn to live with that, and you can't get it wet, you can't have a proper bath or shower. It requires a dressing over it at all times because it's a massive infection risk. It goes straight to the main artery in his heart. So if it was to get pulled or dislodged, that would be extremely dangerous. So he lived about 10 months with that medical device in his chest. And every week he required a dressing change, which is just like, a sticky adhesive dressing that you have to pull off. And then you got to clean it with the sterile alcohol and then stick a new one over the top. But I cannot even put into words how traumatic some of the dressing changes were for him, because it was painful. Like his skin got red raw, and then you're having to hold still. There were times where I had to help hold him down because he would wriggle and move, and it's so dangerous when it's uncovered. Like everything is just a massive infection risk. So just the sheer amount of times that he's had to do things against his will or feel extremely unwell and just sit in hospital for days on end, like the isolation and the loneliness and missing school and missing friends and missing home, missing his pet. Like I feel like all of that's improved somewhat since we've been back home, but then he'll still ask me on occasions like, Mum, will I ever have to have another procedure, we would call them, when he get put to sleep? And I would try to explain like, no, I don't think so, but I don't want to say no for certain because I don't know what the future holds, So I feel like it's very hard to answer some of the things that come up that give him anxiety. And he will have to go to the hospital for the foreseeable future because they have to monitor his bloods for at least the next 5 years and probably throughout his life to just make sure that the cancer hasn't come back. And at the moment, he's having blood tests every fortnight. So every 2 weeks he goes and he gets a blood test done. And thankfully, that's something that he's just taken in his stride, and he's got his routine around it, and he doesn't seem too anxious around it, which is amazing considering where we started with all the needles and cannulas. But yeah, I think even he understands, like I said, that people do pass away from cancer, that cancer isn't something like a cough or cold and you just get over it and you're fine. I think even though no one has said it to him, and I try to protect him from relapse and talk of that, because I don't think he needs to carry that weight at the age of 7. But we try to protect him as much as we can from certain things. And then even he seems to have anxiety around the hospital. But he's overall a very happy kid, but you can just see the times where the medical trauma comes out, and where I can see down the road he's going to need an outlet for that, like someone to talk to, or I think it's going to be something that comes out over years, because when he was in the thick of treatment, if something was wrong, he would just shut down. He would just go quiet. He wouldn't talk to anyone. And I could see like, you're not well or you're really struggling mentally, and you try to talk to him about it, but it's hard, being your own son and everything. He doesn't always want to open up. And it's taken us a long time to get to a place where we can talk about like, how are you feeling physically? Like, are you in any pain? It's taken him a long time to be able to admit, actually, I am in pain, because to him, every time he said he was in pain, then doctors came and poked and prodded him. And, so So now we're in a very good place where he's communicating his pain and communicating what hurts. And I think, like, for families that go through it with even younger children, it must be so hard, because at least at 6 I was able to explain, like, this is something that needs to be done and this is what will happen. And we had child life specialists who are amazing help explain, like, the procedure with the central line and things like that. So yeah, I guess it's just one of those things where at the current state of treatment, kids don't get through unscathed psychologically. They're very much exposed to things that are damaging to them in terms of the isolation and the pain and the forced to do things that are uncomfortable. So yeah, it's definitely another area where we could use a lot more support for the kids and for the parents.
100%. Wow.
Yeah.
That's a lot.
What a trooper Ashton is too, right? And again, I say that heavily and lightly. I say it heavily because, like, it's true. He's a trooper, but I say it lightly because, like, we'd rather he didn't have to be such a trooper. You know, it would be much better if he could just be not dealing with all of this. So thanks for sharing that. And I'm sure, like you said, a lot's going to come out over the course of his life of the way things have impacted him. And I just hope that you don't carry any of that for yourself, because it's not, it has, I know that there's things that you said, like, oh, I wish I could have advocated more, but again, you don't know what you don't know, but it has to be done to make him better. Right. So, before we started recording, Dominique, you were talking about the mix of feelings of grieving what you thought life was going to look like, but also having gratitude for the fact that he's still here. Can you speak on, like, what that has been like for you with this journey with Ashton's cancer treatment?
Yeah, so I think it's when your child first gets diagnosed, you feel like the whole world has just ended, and it's such a strange thing to realize that other people's worlds keep on going around you, because your world has just seemingly stopped, and all your focus goes into your child and their health, and trying to wrap your head around the fact that they even have cancer. And so for our family especially, I felt like I grieved so much of, like, I thought my child was healthy. I just pictured my life, you know, without any hiccups in it, essentially. And you just never know what curveballs life is going to throw you. But because we couldn't go back home, because, you know, I had to stop working as soon as I found out my son had cancer, for me, I just grieved, like, are we ever going to get back to that life? Are we ever going to get back to a life that I even slightly remember? And the ironic thing is now, like, you're so grateful for those small mundane moments of just all being together under one roof as a family, and you're grateful that your child has survived these horrific treatments. But at the same time, you just like, you question, you know, what would our lives be like if cancer hadn't touched our family? And it's very hard to get out of the what ifs of, you know, how would our life be different? Because cancer just touches every part of your family. It touches your personal relationships. It impacts your marriage. It impacts how you relate to siblings that the child with cancer has, because you're focusing all your time and energy onto one child, essentially, just because you're so concerned about keeping them alive, and it changes dynamics you have with your other kids. But at the end of the day, like, how can we not be grateful that he's still here and he's still fighting? And it's been 616 days since he got diagnosed, and each day different emotions come up still, where I'm still processing, like, how is this our life? How is it that I have chemotherapy sitting on my kitchen bench right now that I have to give to my son every day? Otherwise, his cancer might come back. Like, it's just these surreal moments where you're like, you know, how did cancer even find us and touch us, and it's just, you got to wrap your head around so much. And then I try to process it as best I can, but basically, like, as long as he's here and we can keep advocating for other kids and other families that aren't lucky enough to, they're not able to say the same. I just won't ever stop speaking on the issue until there's 100% survival rate.
Oh my gosh, Dominique, what a heart.
Just goosebumps.
Sometimes you say these big things and we don't really know what to say back. I got to be honest with you. Like, it's so hard, not hard for us, hard for, I just hit my mic. Hard for you guys in that you carrying that load of this, exactly what you said, this grieving. What would life be like? How would life be different if this hadn't touched us? But also, I'm so grateful for all of this. And I'm sure even to a piece of it, I don't want to put words in your mouth, but I'm sure even to a piece of, like, I'm so grateful that we have treatment to treat this, but also it's not good enough treatment to treat this, So I'm sure that's a big piece of it too, is there's just so much of a mix of that battle of both things existing in two different ways, and something that is really hard to comprehend if you've never experienced anything like that. So yeah. Melissa, do you have anything you want to ask on that?
No, I'm just mind blown. I have goosebumps because I just in awe. And I keep thinking about, we had that conversation with Heather and she was talking about duality. This is coming into my brain as you're talking. It's like the duality of, and duality is a hard thing for, I think, anybody for that to sink in, but like both things can be true. That whole thing, like, that must just be so difficult to process. But wow. Oh gosh.
Dominique, I want to ask you this. If you could give one piece of advice to any parent going through something similar to you right now, or even to give something to yourself back when Ashton was first diagnosed, what would you say to that person or to yourself?
Honestly, I think to anyone who's going through this at the moment, I think you should give yourself time and space to grieve. I think it was very easy for me personally to just slip into survival mode after about 2 or 3 weeks, where you think you've got your head around all the treatment plans and you just want to focus on what's next. But I think if you can take time to grieve and have those crying moments and give yourself that space emotionally, it's so important, rather than just switching off from that side of things, which is something that I felt like I did for way too long. And then it always comes out in other ways, whether it's, in your relationships or with yourself or your anxiety. I think it's so important to take time to grieve it as much as you can throughout the whole process, because really, I think you're always grieving a little bit of something. It's so much to even wrap your head around, but I'd say try to give yourself that space as often as you can, because I wish I would have done that.
What would that have looked like for you if you were to go back and give yourself that space? What would you have done differently?
I think for me, because I hid so much of my emotions from Ashton, with the view that, I don't want to worry him. I don't want him to ask, am I going to die from this? Is that why you're crying all the time? But then as we got through treatment, there were nights in the hospital where he would cry himself to sleep. And I remember so vividly, he was cuddling this giant dinosaur stuffed toy that he had, and he was just crying and crying. And I said, "Sweetie, what's wrong? Are you missing home?" And he said, "No, I'm scared I'm going to die." And I never said to him, you could die from this or anything like that. But it's like he already had that fear and he wasn't going to speak it to me. because I wasn't speaking anything to him. And that's when I realized the whole approach that I took, it wasn't going to work for us, like for our family, because he was so smart, you know, even at the age of 6 years old, he understood what all the medical intervention was about. Like he understood that he was really sick. So I wish I would have given myself more space around him to grieve and cry. And sometimes you just got to say, like, this is really shit, isn't it? You know, and towards the end of his treatment, whenever he'd have to go through something hard, I would always try to validate him and say, this is really hard. You're being really brave. I know you don't want to do this, but at the same time, like, you know, it's just crap, isn't it? You know, it's just really, really horrible. And you got to acknowledge that with them. And I think the more authentic and real I started being with him, he felt like he could have space to talk to me about what he was anxious about, what he was afraid of, and how he felt. And that was just a thing that we both had to work through together, spending so much time alone in the hospital. But I wish I would have done that sooner, not just for myself, but also for him, like giving him that space to talk and speak up and have negative emotions. It's fine, you know, considering the circumstances.
Yeah. I think that's one of the biggest things that we tend to do as parents is we think, I don't want my kid to see my emotions because I don't want them to know that this is hurting me. And it's amazing that we can do that, but also us allowing them to see the emotions gives them permission to have them too. And because it's easy for a kid to cry and an adult to cry when we get physically hurt. Like when you break a bone or you hit your head on a cabinet, like it's easy to cry in those situations. It's harder, at least from my own experience, to cry when the emotional stuff hits, especially in front of your kids. And to know that to do those kinds of things, like you said, as you did that more, it gave him space to do that more. I think that's really powerful. That's really powerful. And I'm glad that you're able to do that more now for both of your sakes, for both of you. Yeah.
Yeah,
Wow.
it's so important. Like, I think that was just a turning point for me where I realized he already has all these fears and they're the same fears that I have. And here we are trying to like protect each other from the reality of the potential situation, you know. So I was like, oh, wow, like we're both kind of terrified of the same thing, and neither of us have said it to each other. And even though he's 6 and I was 30 something, you know, it's like, wow, I can't believe I was trying to protect him from something he already knew about. And I was just, you know, not giving him that space.
Yeah.
Wow. Holy smokes. Whoa. Dominique, I just want to say I'm so grateful for you spending this time with us today, this evening, today. It's daytime, right?
It's both. It's both right now. It's
both
evening and
duality. I'm just so grateful for you to be so candid with us and share your story with us and spending this time with us. I'm just so grateful.
I just want to say a massive thank you to you both, because I think it's absolutely amazing that both of you take time to champion other causes that you're not directly impacted by, but that you're clearly so passionate about helping and supporting people who are impacted by it. And as I said earlier, I think coming across people who aren't touched by childhood cancer personally, but they want to walk alongside you in your child's fight, it's honestly the most uplifting thing, and it gives families so much hope. It gives me so much hope that there are people out there who do care. There are people out there who do want to know more, and they want to hear our children's stories and hear what these kids go through, and help us raise awareness. It's so valuable, and I can't thank you both enough for doing what you do with your amazing podcast. And I'm a lifelong listener now. I love all of the episodes so far.
Well, thank you. Thank you, Dominique. You don't have to thank us. It's like honestly an honor for us to be able to hold space for these stories. And we truly, this sounds really cheesy to say, but we truly are honored and grateful for everybody who's willing to share their stories, because these are really hard stories to talk about, whether it's a cancer story or anything else. Like, they're really hard to talk about. I mean, they're really hard topics. For some of us, it's easy to talk about. For some of us, it's hard to talk about. It just depends on how you are. But we're really honored and grateful for you being here and sharing this with us, taking your time, all the advocacy that you do, raising awareness for us. Because if it wasn't for you, if it wasn't for Claire, if it wasn't for Catherine, if it wasn't for Heather, if it wasn't for all of these, that we have more people that we haven't talked to yet about this. If it wasn't for all of you doing what you do, we wouldn't know. We wouldn't be able to be in this space. So it's very much a two-way street. So, yeah, thank you so much, Dominique, for being here with us today. We're so grateful. Thank you so much for joining us today. We hope you enjoyed it as much as we did. To help support the growth of this podcast, please feel free to leave us a review, follow us on socials, or recommend us to your friends. Your support honestly means the world to us. With love, Sammy and Melissa.